vaccine programme. Around 3,200 women are diagnosed with cervical cancer in the UK each year, and 99% of these are caused by the human papillomaviruses. But cases of the disease have fallen by nearly 90% among women now in their 20s who were the first generation to get the jab. The vaccine is offered to all girls and boys in the UK at some stage between 11 and 13 years old, depending on where they live. Our health editor, Hugh Pym, reports.
3 women and 3 perspectives on a dramatic step forward with news of the success of the HPV vaccine. Evie missed out at school, but then found she could get the injections on the NHS.
I've now, at 23, got the vaccine. This news is just really, really good because, you can just see that the changes are happening and the vaccine's working.
It's come too late for Lynn, but she knows screening will give early warning of cancer caused by the virus.
The screening has been amazing, so that's helped people in the meantime. But so it is a shame, but at least there's something to moving forward. Really amazing statistics.
A view shared by Penny.
So I think today is it's fantastic news, and it's a fantastic development.
Penny had cervical cancer, but it was picked up early thanks to a smear test, and after a major operation 3 years ago, she's now clear.
When I say to people I was lucky, I say that because I'd had 3 kids. I had no intention of having any more children. So although it was major surgery, for me it didn't have the same impact that it might have on a woman who gets diagnosed in her 20s, who hasn't had any children, who is faced with the option that they have to, have a hysterectomy and they're not going to be able to have children naturally.
The new study looked at the impact of the vaccine after it was introduced for girls in England in 2008. It was also rolled out around the UK and from 2019 to boys aged 12 to 13. HPV can cause some cancers, including head and neck, in men, and the vaccine could help prevent those. No wonder scientists are hailing the significance of the research.
It's a really historic moment to show that at last we have this concrete proof that the vaccine is actually stopping people from getting cervical cancer. So it's an incredible story of the power of science and research and what we can achieve when we put that into practice.
The vaccine could make a big difference in developing countries like Laos, where it's been introduced for girls. Cervical cancer is the 4th most common among women worldwide, with 90% of deaths in low and middle-income countries where access to screening is limited. The World Health Organization has called for global action to eliminate cervical cancer and a major improvement in the health of women, both here and further afield. Hugh Pym, BBC News.
The government's latest coronavirus figures fall